In this lecture, we will study the types of the skin cancers. There are three types of the skin cancers mainly, which are the basal cell carcinoma, the squamous cell carcinoma, and the melanoma. We will also study the different important MCQs related to this topic coming in the part 1 exam. So the basal cell carcinoma is the most common skin cancer, and it is most commonly found in the sun exposed areas of the body. It is locally invasive, but it does not metastasize to the different areas. Okay, now what are the pathognomonic features of these? It is pink, pearly nodules, and with commonly telangiectasias. Now pink pearly nodules, this often comes in the exam. This word you should ratify this word कि जहाँ भी आपको pink pearly nodules हैं, you see these pink pearly nodules, these are pathognomonic of basal cell carcinoma with telangiectasias means कि vessels की abnormality होती है जिसकी वजह से वो reddish color का नजर आ रहा है. There are rolled borders, as you see these are the rolled borders with central crusting or ulceration. You see all these points are fitting into this picture, and it is most common on the upper lips. So basal cell carcinoma has pink pearly nodules with central ulceration or crusting, and it is most common on the upper lips. It is the overall most common skin cancer. Now you should know that these are the upper lips and these are the lower lips. So the basal cell carcinoma, as this B suggests, B for upper lips, and then this S is for lower lips, that is squamous cell carcinoma. You can also remember it like bullshit. So BS, B is above and S is below. So basal cell carcinoma and squamous cell carcinoma below. Now the second most common skin cancer is the squamous cell carcinoma. It is also associated with excessive exposure to the sunlight. It is common in the immunocompromised patients and also occasionally occurs in the arsenic exposure areas of the body. It most commonly occurs on the face, lower lips, ears, and the hands. It is locally invasive. It may spread to the lymph nodes, but it will not metastasize. It does not metastasize. You should know that the basal cell carcinoma, it is also locally invasive, and squamous cell carcinoma, it is also locally invasive. It can spread to the lymph node, but the basal cell carcinoma does not, and both rarely metastasize. It also has ulcerative red lesions with a frequent scale, but you see there are no rolled edges, there are no pink pearly nodules, but you should remember keratin pearls for this carcinoma. So for basal cell carcinoma, these are pink pearly nodules with telangiectasias, rolled border, center crusting or ulceration, whereas for squamous cell carcinoma there are keratin pearls. So now let's come to the melanoma, which is the most dangerous type of carcinoma of the skin. It has a significant risk of metastasis, and the tumor marker for this melanoma is S100. Now there is A, B, C, D, E of the melanoma, which you should be remembering. A is for asymmetry, B is for border irregularity, C is for color variation, and D is for diameter which is greater than 6 mm, and E is for evolution of time. Now what these are the points A, B, C, D, E. These are the points which you should be remembering if you want to know about the melanoma. If a lesion has an asymmetry, it has a border irregularity, it has a color variation, it is changing the color, and if its diameter is above 6 mm and it's changing and it is having evolution over time, then it must be a melanoma. Now melanoma has four types. Superficial spreading, as its name suggests, it is spreading along the skin. ठीक है. Nodular, it is growing above the skin. ठीक है. So superficial is spreading along the skin, nodular is growing above the skin, whereas lentigo maligna and acral lentiguous, they are growing above as well as under the skin. Now we will come to the important MCQs related to the skin cancer. Now we should be knowing that the most common pre-malignant nevus is the dysplastic nevus or the congenital giant nevus. If these both comes in the MCQ, then you have to choose congenital giant nevus. The next common is the intradermal nevus, which is most common in adults. आपको इस लाइन का रट्टा लगा लेना चाहिए. The most common is pre-malignant nevus is the dysplastic nevus or congenital giant nevus. Choose congenital giant nevus over the dysplastic nevus. Then the most common in adults is intradermal nevus. So if the question comes, the pre-malignant nevus most common in adults is, then your answer should be intradermal nevus. But if just the question is what is the pre-malignant nevus, then choose congenital giant nevus or dysplastic nevus, and then compound nevus, and then the most common in children is junctional nevus. So make in this can be mnemonic should be C D I C J, C D I C J. Alright. Now the pre-malignant lesion of the skin is actinic keratosis, as it can lead to the squamous cell carcinoma. Now which tumor is locally malignant? It's carcinoid and basal cell carcinoma. And which nevus has the highest occurrence of malignant change? That's congenital giant nevus. Okay, so remember, congenital giant nevus has the highest occurrence of the malignant change. If there is a child with a bald patch on the scalp since birth, and this patch is leathery in nature and has papillomatous projections and sebaceous gland on histology, this can be sebaceous nevus, and its most common complication is basal cell carcinoma. ठीक है. You should be knowing कि किसी में भी लीजन में भी अगर वो हेड पे है और वहाँ पे बॉल्ड पैच है and it is leathery to see and it has projection and sebaceous gland, that it can be sebaceous nevus which can cause the basal cell carcinoma. Now basal cell carcinoma, as we know, it's most commonly occurring on the upper lip and it's related to the smoking and the sun exposure. Now let's come to the malignant melanoma. Its risk factor are xeroderma pigmentosum. It is a defect of the gene repair, and the other is the sunlight exposure, history of the family member with the melanoma, use of tanning boots, dysplastic nevus syndrome, or history of melanoma in first, second or third degree relative. You should just be knowing that the xeroderma pigmentosum or the sunlight exposure are the most common risk factors of the malignant melanoma. Now in malignant melanoma, the first cells which are going to present are the natural killer cells. Alright. Then the most aggressive tumor is also the malignant melanoma, and this malignant melanoma metastasizes to the liver, and its important marker, as explained in the lecture, is S100. Now as we know that the squamous cell carcinoma has prickle cells and keratin pearls. So also remember this. Actinic keratosis can lead to squamous cell carcinoma. The most common malignancy in the marginal ulcers is squamous cell carcinoma. सही है. Squamous cell carcinoma is also associated with the HIV. Now what is marginal ulcers? जहाँ भी कहीं burn हो और उस burn की वजह से जो ulcers बन जाएं वो marginal ulcers होते हैं, and with the period of time they change into the squamous cell carcinoma. Betel nut chewing is related to the submucosal fibrosis, And the leukoplakia precursors are the spices, spirit, and the chronic infection. And in leukoplakia there are corrugated plaque on the lateral surface of the tongue. Syphilis is not the precursor of leukoplakia. Now it also comes in the exam that what is the incidence of lichen planus for the malignancy, and it is only 1 to 10%. Just remember it. Basically I'm just reading them out so that it gets stuck into your mind, because there is no other way you can remember it. There is no explanation for it, and you just have to remember it. That's what the part 1 is. Now you should also know that the lichen planus is also associated with hepatitis C, and if there are finger-like projection on the upper lid, it is the papilloma. The most common skin cancer in HIV is Kaposi sarcoma, and if there is a 40 years old male who is homosexual with raised brown lesions on the groin and his partner has also the same lesions, it's most commonly Kaposi sarcoma, and it's caused by the human herpes virus 8. So just go through these points. These are the basic points that actinic keratosis lead to the squamous cell carcinoma, and keratin pearls are present in the squamous cell carcinoma. Margarine ulcers, which are the burn ulcers, can also lead to the squamous cell carcinoma, and it is also associated with HIV. Moreover, lichen planus has 1 to 10% incidence of changing into the malignancy, and it is associated with the hepatitis C, and the most common carcinoma in the HIV is Kaposi sarcoma.